Okay, Senator Debbie Stabenow is the chair of the Senate Finance Subcommittee on Healthcare. She's made behavioral health a key focus of her policy initiatives, passing legislation that led to the creation of 300 certified community behavioral health clinics in 41 states and Washington, D.C. And I want to brag for a minute. I think right after that passed, I was one of the first people to interview Senator Stabenow on that years ago. So, Senator Stabenow, it's great to see you as always. Look, pandemic, economic crisis, racial divides in this country. What's the state of healthcare in the United States?
Well, Steve, first of all, it's great to be with you.
Mental health care, yes. Mental health.
Yes, well, it's wonderful to be with you again. I appreciate your ongoing interest in understanding that mental health and substance abuse, behavioral health, as we call it, is part of healthcare. Healthcare above the neck is as important as healthcare below the neck. And the pandemic has really shown a bright light on so many things, certainly in healthcare, certainly around racial disparities, and certainly around the needs of behavioral health. And the good news is that we're actually moving forward. There's not as much public focus on a regular basis, but there's actually some really good news to talk about. Since you and I first talked about this, and my partner in this is Senator Roy Blunt, this is truly a bipartisan effort. Way back in 2014, we passed what's called the Excellence in Mental Health and Addiction Treatment Act to mirror in behavioral health what we do in community health care. We have something called federally qualified health centers, and they, if you want to get that designation and the full funding, you have to have high standards, meet standards, and then you get full funding for the work that you do in the community, not grants. It's part of the healthcare system, Medicaid and full funding. So we've now put that model in place. It's not yet nationwide. That's coming soon. We're actually introducing a bill later this month. But the point of this is to say that on the behavioral health side, which the needs have grown and grown and grown under COVID. And I should say that, before COVID, 1 out of 5 Americans had a mental illness or a substance abuse issue sometime in their life. That is much higher now. And we're seeing anxiety and depression and suicide, not only in adults, but in children, and PTSD and people who've had to go into emergency rooms every day, our doctors and nurses and everyone, the pressure that people have been under. So it's gone up dramatically. But the good news is that when we put in place a few years ago, a demonstration project of 8 states fully getting funded for providing 24-hour psychiatric emergency crisis services for folks, as well as helping families, coordinating with the healthcare system and all the other things. We found 3 things happen. 60% fewer number of people going to jail just because the police officer had nowhere else to take someone who needed some kind of help. Now they can go to the behavioral health clinic. 60% fewer people sitting in an emergency room, usually with a police officer sitting there with them or a family member trying to figure out what to do because there's no mental health or substance abuse services. 63% fewer incidences of that, and more than 40% reduction in homelessness that is so connected to folks oftentimes that are struggling. So in the pandemic, we have actually increased money for startup grants to get things going. We've got 300 clinics across the country in 41 states. We added 100 more clinics in the American Rescue Plan, in addition to the full funding of the demonstration projects. And what we are seeing is it makes an incredible difference, not only in people's lives and families' lives, but this is wholeheartedly supported by law enforcement, who knows that needs to be the resources for people, that they can't be the ones doing this. And they are thrilled that we're seeing strong community services that are available. So the next step is Senator Blunt and I want to take this nationwide and say to any state that wants to be a part of this, if you meet the high quality standards, we're going to fund your community mental health and addiction services, just like we fund physical health, and actually support the people in the community that need help.
I always love talking to you about this because you're so full of energy and passion about it. I don't think anybody could say no to you in this mode. But it does, because I know you've worked with Senator Roy Blunt. Recently, I had Senator Rob Portman on, who's going to be retiring soon. We talked about opioids, along with Senator Shelton Whitehouse. I know you've been working with John Barrasso and others as well. And so my question is there as eager an appetite and passion on this among some of your Republican colleagues to make sure that this gets ongoing support? I mean, what is your sense? I mean, my sense is you've achieved a lot with these Republican colleagues. Unfortunately, a lot of them are retiring soon. How deep does their passion go?
Well, Steve, I told Roy Blunt he's not allowed to retire. I'm going to put him in a room somewhere and lock the door because he has been such a wonderful partner, and his lead role on Appropriations Committee, has really been invaluable. Here's what I will say that's very interesting. And, healthcare, no question, and really in an extremely unfortunate way, is very political. And so even when we look at COVID, how in the world, solving a health pandemic could be so political is beyond me. And it's certainly healthcare funding and so on has been political. What is interesting is that Senator Blunt and I have really kept our heads down and kind of just kept working. And through the entire Trump presidency, this was the only part of healthcare that they did not propose cuts in. In fact, we actually were able to, because of the results, because we had law enforcement support, because on the ground it actually works when you provide real services to people for mental illnesses and substance abuse issues. It actually really works and it really saves money. And so we just kept our heads down. And even in the Trump administration, who was trying to repeal the Affordable Care Act and all the other attacks, they supported and did not once propose funding cuts in this area. And so in every COVID package, we actually provided dollars, both in the last Congress. And of course, now it's even more robust because President Biden gets it in his core and has a full nationwide funding as part of his long-term proposals. And so now we're in a great spot. But the truth of the matter is, this is all about just saying over and over again, this is healthcare. You would never say to somebody who needed to have heart surgery, I'm so sorry, but the grant ran out.
Right.
Nothing we can do about it. We say that every day to somebody with a mental illness, every day to somebody with an addiction.
I know your work and the centers are so important. I know President Biden's plan is out there. There's another question I'm out there sort of struggling with. I'm wondering if you're on it as well, which is, when you look at what we were trying to do with the American healthcare system is to move towards a wellness system, towards outcomes, look at, how you get wellness built in. That's a different orientation than fee for service. And those that were driven for fee for service were tending not to fund the mental health because, let's be honest, it wasn't profitable for them. And so it was kind of a missing dimension. I don't know where we are. I sort of feel like we're in a gray area between these today. Is there more that needs to be done so that pricing of the mental health dimension of someone's overall health is built into wellness? Does that make sense? Am I asking that the right way?
It does. Yeah, see, it does make sense. And I actually think the work that we have been doing in communities is one way to show that this can pay off, because in order to be able to get the enhanced funding for services under Medicaid and other reimbursements under healthcare for behavioral health, our community behavioral health efforts, you have to work with the health center locally. You have to do preventative work and work in a more holistic way with people. And we're finding that when we look at the whole person and actually are funding this in a way that encourages wellness and health, you find that when someone gets their mental health needs taken care of, they're also more likely to take care of their physical needs. They're more likely to take their blood pressure medicine, or if they're diabetic, to take their insulin. They're more likely to go get healthcare checkups. The whole integration of what we're doing in the community around physical health and mental health really shows what needs to be focused on the front end in terms of wellness and incentivizing wellness.
Oh, look, we are taking questions from the audience, and we've got one for you here, Senator, from Paul Kelly. Paul?
Hi, Paul Kelly here. I'm the president of Capital Advocacy and Government Affairs and also a consultant to the Livingston Group, a government relations firm here in Washington. Thanks to Steve Clemons and The Hill for another great webinar. I was wondering if the panelists had any opinion on whether we can create the proper incentives to use more primary care versus specialty care in the healthcare system moving forward. Thanks.
Any thoughts on primary care
Great.
versus
That's
specialty
a great
care?
question. And again, from our standpoint, as we are modeling behavioral health in the community, it's very much about primary care. The requirements are that you have to do primary care and work. And in fact, in a vast majority of the new clinics, behavioral healthcare clinics, we are seeing them in the same location as the federally qualified health centers. So you've got the health clinic, behavioral health right there, because it's very much about primary care and incentivizing primary care, so that we're talking about on the front end, not waiting till someone has a serious issue, but trying to make sure that we're helping people on the front end. And that goes also in a broad sense, Steve. This is about good nutrition. This is about, listening to Dr. Lee talk about using technology and so on. I mean, there's so many ways going forward that we need to look at incentivizing primary care and wellness. And that really is the future.
Well, let me just say this to my audience. Debbie Stabenow, Senator Debbie
That's okay,
Stabenow
Doctor.
has
Yes,
probably done more to make sure that our discussions of health do not leave mental health outside the door than any other person I know. In the last 8 years, you've normalized this. I mean, when we had talked after the National Council of Behavioral Health started a program on mental health first aid all around the country. Why? To destigmatize this discussion. All the things you're doing, creating an infrastructure with these mental health centers has done that. So I just really want to salute that, because I think it's so important. So great to see you. Thank you so much, Senator Stabenow, for joining us today. And sorry to make you maybe you are a doctor. I mean, in my book, you're a doctor and a senator.
It's always wonderful to be with you, and thank you so much for always including mental health in your discussions on healthcare.
My privilege. Thank you so much, Senator.